Hi, I'm Bill Patten, Interim CEO here at Rehoboth McKinley Christian Healthcare Services. I want to give you a report from the regular board meeting that was held yesterday, June 26th. Our chairperson, Genevieve Robrand, called the meeting to order at a little bit after 1 o'clock. The board reviewed minutes from the May board meeting as well as a special board meeting that was held on June the 13th. Both sets of minutes were approved. The board then reviewed minutes from a number of other board committees. They didn't have minutes from a May quality meeting. That meeting had to be canceled due to personnel issues. They reviewed minutes from the Medical Executive Committee. Those were accepted. They reviewed minutes from the Credentials Committee, including the list of privileges that the medical staff had forwarded to the board. As I think you may know, the medical staff reviews and recommends privileges, but it's the board that has the authority to grant them. So the board granted the privileges as suggested by the Credentials Committee and the Medical Executive Committee. And then the board had a quick review of the Finance Committee. It was held on Monday afternoon, and I'll talk in a minute about some of our financial progress that's taking place. The board heard a report from Rebecca Martell, our Chief Human Resources Officer. Rebecca was able to give the board a number of items of good news, including progress we're making hiring and in some cases rehiring employees. We have recently done a social media effort highlighting why our employees are saying yes to working here at Rehoboth. So very good news on that front. I'm happy to report that we've made excellent progress reducing the number of traveling staff that we have, especially traveling nurses. We have, I think right now, 7 to 10 traveling nurses, but we have nurses training, hired and training to replace almost all of them. So significant reduction. I think I've mentioned this before, but during the height of the pandemic, we had 51 travelers. That was the most that we had. So to be down to in the neighborhood of 10 is excellent progress. Saves us a lot of money, and we believe that permanent staff provide a more consistent level of service to our patients and to other employees. So that was good news. On the finance front, Chris Dover, our interim CFO, gave a summary of our first quarter financials. We are working hard to get caught up on reporting financial statements to the board. We now have financials for January, February, and March, and our plan is to have April and May presented to the board at the July board meeting. But let me share with you a little bit of the results that we've had from the first 3 months of this fiscal year. In January, we lost $100,000, and that's a lot of money, but compared to what we lost a year ago in January, significant reduction. In February, we lost $186,000. In March, we actually made $237,000. So for the first 3 months of the year, the first quarter of the year, our net loss was about $50,000. If you look at last year, the same period of time, we would have lost over $6 million in that period of time. So the first 3 months indicate the progress that's been made reducing the expenses of the organization. On a month-to-month basis, we're seeing expenses about $1.5 million less than they were a year ago. It also shows the progress we're making increasing the volumes, the services that we provide. And it's important to note that these changes have been made without a reduction in service, and it has also been something that we've been focusing on quality, so no reduction in quality. So good progress on the financial front that Chris was able to present to the board. Then Eric Jones, the Senior Vice President of Ovation, our new consulting and advisory services company, gave a lengthy report to the board highlighting a number of the financial assistance efforts that they have underway. Eric is working with Chris to review our past finances in an effort to create a budget for fiscal year 2024. I've mentioned to you in previous reports that at the end of 23, when we normally would have approved a budget, one had not been prepared. So our focus has been on getting the hospital viable, but now that we're in a little bit more stable position, we are wanting to present the board with a budget for the rest of the fiscal year, so it would show actual numbers for the first 6 months of the year and then projected numbers for the final 6 months of the year. In my report to the board, I highlighted work that we're doing on recruitment. I was happy to report that earlier this week we had a site visit for a podiatry candidate. The board actually reviewed and approved his contract, and we heard the morning after the board meeting that the candidate has accepted our offer. So that's very good news. Now we just need to work out the details of getting him licensed in New Mexico and getting him credentialed with all of the necessary insurance providers. Well-qualified candidate. He's a Cuban-American immigrant, currently practicing in Bakersfield, California. We think he will be a good fit here in Gallup. Anxious to have him join us. Dr. Carlos Rodriguez is his name. We also reported to the board that our pediatric nurse practitioner has given her notice. We're talking with her to see whether or not we might be able to convince her to change her mind, and if not, we'll be taking the steps necessary to recruit another pediatric provider, whether a nurse practitioner or whether a full pediatrician. We received communication from Dr. Liu. As I've mentioned in other reports, Dr. Liu and the Healthcare Advisory Committee have been working with the hospital in preparation for the community health needs assessment that we need to do next year. Dr. Liu and her group had done a survey, had responses of over 50 people, showing what we need as far as new members of the medical staff. As I mentioned in other reports, we've been working with our medical staff to make sure that what administration thinks we need and what the medical staff thinks we need are aligned. So we were happy to get the report from Dr. Liu and her group. We also talked with the board about work that we're doing to expand our current cardiology footprint. We want to have a more robust cardiology practice, both in the clinic, but also supporting the emergency department and the inpatient units, our hospital as providers. So we're looking at a number of options. We're actively talking with our medical staff to make sure that the model that we're designing and will be proposing to the board is exactly what our medical staff needs. So we're talking with our current group as well as other groups outside of the Gallup area as far as options to provide expanded cardiology services right here in Gallup. We're requesting a number of pieces of equipment from the board, and we're planning to pay for this with money that is supposed to be coming any day now from FEMA. This is money that's related to expenses that we had during the COVID-19 pandemic. So the summary that we presented to the board that were actually approved but won't be bought until we get the money from FEMA was new software for our sleep lab. Now that we have Dr. Flor Gonzaga with us, we'll be able to get the sleep lab up and running again. That was approved for $75,000. We have to do work on our computer system, both new software and then retraining for our employees. That project is estimated to cost a little bit over $511,000. The board approved that. We need to get new anesthesia machines and new patient monitors in our operating room. That project is estimated at $300,000, which was approved by the board. And then the table for our orthopedic surgeons needs to be replaced, and that is estimated at just over $60,000, again approved by the board. So all of these purchases are contingent on receipt of the FEMA money, so they will not negatively impact our ability to pay our bills or to meet payroll for our employees. We were happy to report to the board that we have paid the second half of our annual premium for our malpractice insurance. We pay over $1 million a year in malpractice fees, and we are able to split it into two payments. So we paid $529,000 in June, and that was directly from hospital money. We were able to do that because of the continued support for our payroll that we're getting from the city and the county. We continue to work with the county and the governor's office regarding the money that was appropriated in House Bill 2, the $12 million for payroll support and the $15 million for debt reduction. I've had meetings with the county leadership as well as representatives from the governor's office, and we're looking at the timing and the process for which that money will actually begin to flow. We believe that that will happen in July and then moving into August. I was able to report to the board that our overall accounts payable have been reduced. Back in November when I got here, we had $33.5 million in accounts payable. We've now dropped that to just under $22 million, so almost $12 million reduction. A lot of that is with the support of the city and the county, with the back support from the state, but part of it is coming from negotiated settlements that we're making with some of the vendors. We've saved $1.1 million in negotiated settlements, and then the hospital actually has been able to pay a little bit of its own money to meet those reductions. Still a long way to go, but I'm confident that with the support that we're receiving from the county and the state governments, we're going to be able to entirely pay off all of our debts. We're working with Senator Heinrich's office on two different projects. One is an employee retention credit application that we made that would have significant reimbursement for us. And then we're also working with him on an immigration issue related to one of our physicians. We're also beginning to look at two of our old computer systems, Athena and Meditech, and asking the question, when is it time to turn those systems off and potentially write off some of the old accounts receivable that are in them. Happy to report to the board that our second new chemistry analyzer has been received. It is now being installed. It will take several more weeks before it's up and live. This analyzer, similar to the first one that we got, expands the chemistries that we're able to do on site, and it improves the turnaround time so that especially for the emergency department and the advanced care unit, we can get test results to them very, very quickly. Once I completed my report, the board had a conversation about different board committees and the potential of restructuring them. So the board decided that it would hold a special working meeting between now and the July meeting to continue that conversation. The board did elect new officers. Genevieve Robrand, who has served the board admirably and most recently was our board chairperson, she resigned. Yesterday was her last meeting. We actually had a celebration thanking her for her years of service. But the new officers for the hospital board are Marianne Eustick is the chairperson, Skylar Stevens is the vice chairperson, and Dr. Warren Anderson is the secretary treasurer. So those offices will take effect immediately. And then the board went into executive session to discuss personnel issues, legal issues, and contractual issues, all of which are confidential and are privileged by law. Hope you found this update useful. As always, don't hesitate to reach out if I can be of further service. Thank you very much.